Welcome back to N-Powerment Nursing. I'm Linda and this is Ashley and we are nurse educators. You have tuned into our series In the Know where we make it simple. Today we are simplifying ways to use your own body to get to the right answer.
Sometimes we think when we are learning about nursing and learning about anatomy and physiology and biology and chemistry and all these great things, that we are learning something outside of ourselves, right? It's located in a video, or it's located in a slideshow, or it's located in a textbook. But really we're learning about our own bodies. We're learning about ourselves, how we work inside of ourselves. So there's so many opportunities that I've discovered now through teaching where you can use your own body in a test, right? Or even in a patient situation to come up with the right answer on the test or to come up with the right intervention for a patient. So we're going to prove that to you. I've brought a little doll with us that's going to help us out. So we'll just sit her here. She's going to fall over, I'll hold her.
Okay, the registration exam is a safety-driven exam. So there's a large number of questions around safety. So many, in fact, that we have listed positions within our textbook, a whole page.
I think there's 3 pages, actually.
3 pages.
There's 3 pages in there, yeah.
Right, so examples would be in which position you place a patient post-liver biopsy. In which position would you place a pregnant woman, particularly if the fetal heart rate is dropping? In which position would you place a patient in respiratory distress?
Right? Now let's make it simple. So you've probably noticed by now, if you've been watching us on YouTube or Facebook or anywhere else, Instagram, you may have come across us, that we draw a lot of pictures and we use a lot of props. And that's because this is how you make difficult concepts a whole lot simpler. So let's talk first about positionings for safety. There's a lot of questions on the registration exam about this post-operative patient has an incision in this place of their body. Where would you put them in terms of positioning? So I teach students to draw the incision on yourself. For example, if you have a post-operative patient who's had a throat surgery and they have an incision from here to here, if you sit them up, the incision is closed. If you lay them down flat, the incision comes wide open. The same thing can be said about an abdominal incision. If the patient is sitting up in semi-Fowler's, that incision is closed. If you lie them flat on their back, however, that incision is going to come wide open. So when it comes to incisions, draw those on your own body, move, and see what happens. It's going to help you get to the right answer. Other things, chemistry, not my favorite subject, if I'm being honest. I did super well in chemistry, but did not enjoy it. Shout out to everybody that loves chemistry, that's awesome. However, whenever things get chemical for me, I just think, oh, that's so hard. But when we talk about chemical things in terms of the lungs, for example, you can use your own body to get the right answer, even though it's about pressures and gases and moving and this stuff. Hear me out. So, if you take a deep breath in, your thoracic cage goes up, it fills with air, so the diaphragm muscle must contract down because there has to be space for the air. When you breathe out, the air goes out, the thoracic cavity gets smaller, the diaphragm muscle then has room to rise up higher, right? So you can come to the right answer about even biological questions like that. How about a liver biopsy? Well, you have a body. If you passed biology, which you should have, right? You should know that your liver is on your right-hand side. So after somebody has a liver biopsy, this means basically they puncture a hole in the right-hand side, they take out a sample of something. You would want to place that patient on the right-hand side to put pressure over the incision, right, to stop bleeding. So use your own body to figure out the answer. Gravity, huge concept in nursing in terms of what position do you put the patient in. So let's think about this. I think we should name her Giselle, okay? Giselle, if she has heart failure and she has fluid building up in her legs, the fluid is sitting in her lower limbs. When she lies down at night and based on gravity, that fluid drains back to her heart. The heart has problems, so that fluid's going to back up into the lungs. And this is why heart patients have difficulty breathing at night or dyspnea. And this is why we ask them, how many pillows do you have to use to go to sleep? As one of our subjective data questions, okay? Much like if Giselle is dying, okay, and she's bleeding out, we would place her in Trendelenburg position because we would want the blood, not down here in her feet, because we really don't don't care if the toes get oxygen in a life-saving situation. We want all of the oxygenated blood to go to the brain, the heart, and the lungs. So we place the patient kind of upside down like this to keep all of the oxygenated blood up here. Another good example of positioning is if a baby has cleft lip or cleft palate, what position do you put them in after birth or after the surgery? So if a baby has cleft lip, the sutures are going to be on the outside of the mouth. You might think you would want to place the baby prone to promote drainage, right? So they don't aspirate on that, but that's not the right answer because the stitches are on the outside of their lips. So after a cleft lip repair, they have to be placed on their back or supine or on their side. However, if it's a cleft palate repair, the sutures are on the inside of the mouth, so now we would want to place them prone to promote drainage, right? But knowing where those sutures are and thinking about your own body, again, will help you come to the right answer.
Fantastic. We hope that this has demonstrated how you can simplify ways to use your own body to get to the right answer.
Or a Barbie, right? So we invite you to subscribe to our live videos. Just hit subscribe and you'll be notified whenever we go live. We do content videos, we do strategy videos, we do question videos, emotional readiness, stuff like this. You can also subscribe to us on YouTube, like and share this video with your nursing friends. Be sure to follow our Facebook page as well as check out our website, www.N-Powerment Nursing.com, where you can see our complete content text and study package as well as testimonials and experience our free trial.
If you like the way we teach everything you need to know to pass your registration exam just like this. All the content and all the systems. We'll see you next time on In the Know. Bye for now.